Dr. Mark Mostert is our guest. Now, Dr. Mostert, I'm curious, you said something in that previous segment before the headline there that really kind of perked my ears up when you were speaking about the UN. You said they came up with something that sounded good at the time. Oh boy, could we just we could do Mad Libs with that for inserting policies and billions of dollars into things that sounded good at the time. And I can't help but think about the World Health Organization right now because they're working on, the horrible Tedros and crew and Gates and all their buddies in the CCP. They're working on what's colloquially termed as a pandemic treaty. And they want multiple sovereign nations to sign on to this pandemic treaty, which would give them more power and remove more sovereignty from nations and states and human beings. What do you think about this thing, and how could that make this even worse? Because we're talking about a Venn diagram of systems of things right here that add too much bureaucracy. What happens when the globalist overlay gets put on top of it?
Well, that's exactly right, because what this is all about in the end is power masquerading as do-goodism, right? You think about the UN. When you're in a room full of international diplomats and heads of state, it's a very heady brew, to be quite honest, right? Everyone's got security, everyone's dressed to the nines. Here's this powerful person from Europe, this powerful person from the Far East, and it's great. And all they do is talk and talk and talk. And I think your point is really good. Aside from that, all the underlying and undergirding agendas is where the damage gets done. When the diplomats are talking wonderful stuff, that's great. But those bureaucrats, those 30-year career people in all of these places, whether you're talking about big pharma, whether you're talking about whatever, they run the show. And by the way, that's one reason why the US has not signed this disability treaty, because they figured out if we did, we would then be beholden to international rules that maybe we didn't like. But I don't think getting involved in that helps us and the people where it should on the ground level. How does signing this treaty in New York help a poor little girl in Tanzania who has albinism, who gets her arm chopped off because that's taken off as a magic piece of her body to do who knows what with? How does that help her? It doesn't. But I'll tell you what it does help. Fancy and glitzy parties at the UN, very expensive ballroom dinners. That's where the money goes. And on the ground, it's fascinating. On the ground, the amount of money that's spent on quote unquote infrastructure and resources. You see people riding around certainly in South Africa, where I'm from, in these massive SUVs, with UN on the side, brand new vehicles that I'm sure cost $100,000 a piece, right? That's what they do. They ride around, and every now and again they'll get out and pat some poor little kid on the head, and nothing ever gets done. But the layers of bureaucracy in all these edifices is where the trouble starts. I mean, you look at the Biden administration, perfect example, right? I don't think there's anybody that I know, and this is my opinion, thinks that Biden is running the country at this point. Well, who is? It's the bureaucrats who've been there for 20, 30 years. They know the dance, and none of it helps you or me as people who enjoy freedom, who want freedom, and see it being encroached upon every day.
Yeah, well, but what you've just described, Dr. Mostert, is what we euphemistically refer to as the deep state. In this case, though, of course, it's on a global scale. These bureaucrats are the same. I don't care if they're from Washington, D.C. or Berlin or London, wherever. These bureaucracies never do what they claim to do. Boy, but they love to check the virtue boxes. And power protects power. And it seems that what you're saying, it sounds like, is we need to get a little bit more local with this care for folks with disabilities, just folks in general, really. Go to where the problem is and deal with it there, as opposed to having a whole bunch of, we're going to be having our lavender martinis in the in the East Room of the UN, and we're going to discuss the shaman's work on a little girl with as you mentioned, in Tanzania. That doesn't do a damn thing. Deal with the problem in Tanzania. I mean, how do you deal with this? Obviously, your point is well made, but how do we get to that point where we can get the power structure out of it?
Well, first of all, you have to, the old cliche about speaking truth to power. You have to go into these organizations and you have to partially become a creature of the organization until you can get into a position of power to say, where did this money go? Why can't you account for it? And why should we give it to you again? You don't see any of that happening. As you say, drinking the martinis, that's where all the deals get made. We've got absolutely, accountability is the key. Okay, you gave country X $1 billion. Where's the money and what do they have to show for it? Okay, on the ground, at the grassroots level, you have to talk to people in the community and saying, how can we help you? Because a lot of the stuff that NGOs doing is for the NGOs. That's what they're doing it for. They turn up with their bright, shiny beads, and everyone's like, oh, okay, we'll go along with it if we want to, but it's not addressing the need. And I just want to mention a related point that I think is incredibly important. You know, we hear a lot in this world today, in this woke world, about how all cultures are equal, et cetera, et cetera, et cetera, and you can't be judgmental. Let me tell you something. One of the biggest ways we can talk to this, certainly in the developing world, is to break down the culture of negativity that comes with having a disability. I mean, I mentioned Tanzania. There's several other countries in Africa where people with albinism now are pretty much kept in not concentration camps, but in protective camps because people kill them because they consider them ghosts. That needs to be broken down. If you look at the medical professions in these countries, the medical people all have these incredible biases against people with disabilities. That's where we need to start. When we go to a doctor and the doctor says, well, your life is not worth saving because you have disability X, that's the place to step in and say, no, you can't do that. You can't discriminate based on this, and you have to fight that one thing at a time. That's not the whole picture, but I think that would be a good place to start.
Yeah, I agree. And in our last minute or so, I mean, it shouldn't be difficult to follow the money, right? Like you go into an NGO or any, insert bureaucracy here, look at what their annual budget was, look at what they did to it. I'm sure you've probably explored this. What percentage of these budgets actually go towards policies that help the people they're intended to help rather than be a self-licking ice cream cone for an NGO or a bureaucracy?
Yeah, I wouldn't be able to give you a proportion, but I can tell you a significant amount of any money going to any NGO does not get to the people it was supposed to help. Because so much time is spent on things like, having reflective sessions at a 5-star hotel, all this nonsense, and then swooping in, and again, I think this is kind of racist in many ways, swooping into some African country and saying, we're here to save you because we know exactly what you want. And the poor people on the ground are like, no, that's not what we need. Sorry, we need something else. So I think, yeah, all of this together means, and I have a passion for people with disabilities. I did that as an academic career for 35 years. Is the help is not getting through. The biases are so strong in many of these countries. The corruption is so bad. There's another good point. In corruption, in judicial and financial corruption, and as you talked about, yeah, you can go to NGOs and you can certainly see where the money went. But I'll guarantee you when you get to the end of the spigot, you will find that a lot of that money cannot be accounted for. It's either disappeared or it's gone into things that are completely irrelevant. That whole structure, again, also needs to be rectified. Another very bureaucratic structure, obviously.
It does sound like what needs to be done here. And I think you said it, Doctor, speaking truth to power, auditing these NGOs, auditing these bureaucracies and saying, look, here you go. This is what we set aside for you. Go show me the receipts. Where did it go? Because if you're going to start showing me receipts for steak dinners, and lobster bakes, we're going to have a problem, and we're not going to give you the money anymore. I mean, it does seem to be just such a problem that could be so easily overcome, but here you go, the human condition comes in, doesn't it, Doctor? And the greed comes in, and all that other garbage that goes with it.
Yes, it all does. And unfortunately, there's not enough people willing to stand up and speak about this stuff. If many people who, certainly in the activist community, would stand up and say, where are the things that we were promised? You have this policy, where the money's gone there, the money's there, I can't access it. That's what we at Able Americans are doing. We're going to start hammering, for example, HHS, the Health and Human Services people, to say, you guys are not doing the job, and we just discovered why, and you need to change this policy because it's not working.
Yeah. Absolutely. Very well said, sir. And thank you for your perspective. This is such an important topic. We all know someone, or maybe you are someone that's dealing with this. We've spoken to people from, dealing with the VA to dealing with their insurance agency, and they get a lot of that. Well, it's not our problem. It's their problem. Call them. Oh, it's not either of our problem. Call the third party. Before you know it, people are giving up and they're having a hard time. And it's the holidays right now. So we're here to inject a little bit of common sense and a little bit of hope into this time of year in particular. But this needs to be something that is fixed 365, 24/7. We've had enough of it. I don't like seeing veterans rolling around on their rascals looking cold outside the VA in my town. It just feels wrong. It just feels so wrong. So thank you so much for joining us here on State of the Nation, Dr. Mark Mostert. Where's the best place for people to keep up with you?
They can keep up with me at the National Center for Public Policy Analysis. And Able Americans is one of the 4 major projects we have going. We'd love you to join us, sign up for our newsletter.
All right, excellent. So get on over there and help Dr. Mark Mostert out and his colleagues in this wonderful endeavor. This is State of the Nation on today's News Talk, TNT Radio.